In today's video, I'm going to show you a free, simple, at-home technique that you can use to alleviate symptoms of GERD, IBS, and SIBO. I have been using this technique for years with my patients and students and found that it works phenomenally well for symptoms of acid reflux, bloating, abdominal distension, and abdominal pain. And the best thing about it is this is free, and you can do it as much as you want because you're never going to overdose on what I'm about to teach you. So first things first, let's go ahead and get in position. Now, as you get better at this skill, you could certainly try it in a chair or in your car or elsewhere. But for starting, I want to have you lay flat on your back with your knees bent and your feet on the floor. Now, you could use a cute yoga mat like I have here, or you could do it on the floor, on your bed, with a mouse on a house. It really doesn't matter. It's going to work regardless. But the point is that you want to be comfortable and you're going to be sitting here for a good 5 or 10 minutes. So once you are in that position and you are laying flat on your back, knees bent, feet on the floor, and your knees gently resting together so that you don't have to hold them up, that's going to allow you to focus on your belly. And that's what we're going to be doing. We're going to be doing belly breathing, aka diaphragmatic breathing. The diaphragm is a big dome-shaped muscle that separates your abdominal cavity, so stomach, intestines, liver, etc., from your thoracic cavity, which contains your lungs and your heart. And it's supposed to be your main breathing muscle. But a lot of us, myself included, find ourselves living a life where we're taking very shallow, rapid breaths, and we are breathing primarily from our rib cage and our neck. And that's not what you want to do. That is signaling to your nervous system and your vagus nerve that you're in danger and that you are not safe enough to eat your food. So we are training you to learn how to breathe with your diaphragm again and learn how to belly breathe so that your vagus nerve gets the memo that you are actually safe enough to digest your food. Now, the best way that I've heard this explained and how I choose to teach it is that you're going to put your hands on your belly on either side. And then you're going to imagine your belly is a balloon and you're going to inflate that balloon as you breathe in. And then when it comes time to exhale, you're simply going to release that pressure and allow the balloon to deflate on its own. So you take a nice deep breath in through your nose and inflate that balloon. And then through pursed lips, you can go ahead and release it nice and gradually and go back to a resting position. Now, it's going to feel a little bit silly at first because you're going to find yourself intentionally poofing out your stomach, and that's going to feel really weird and kind of stupid. But I assure you, this technique will work if you give it some time and you practice it diligently. And like I said, you're not going to overdose on it anytime soon. You could do this multiple times a day. You could do it for 20 minutes at a shot. You're going to be able to do this as much or as little as you like. I think a good starting point for most people is to do about a 5-minute session in the morning and then a 5-minute session at night. But you could also experiment with doing this technique for a couple of minutes before each meal. So perhaps, 3 minutes at breakfast, lunch, and dinner. You could really play with this and see where you find the most benefit. But again, remember, you're going to be breathing in nice and slowly and deeply, inflating that belly balloon, letting your hands move apart and expand as the balloon inflates, breathing in through your nose. Then, when it comes time to deflate the balloon, just gradually release that pressure, breathe out through pursed lips, and allow your hands to come back together and allow that balloon to shrink back down. And that's the whole technique. Just in and out. If you want to play some nice music, that's fine. Don't listen to a podcast. Don't listen to YouTube videos. Make this a relaxing thing. That's the whole point. But go ahead and make this a relaxing, enjoyable experience. And I think your vagus nerve will thank you. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.